nurse today. You're here for a physical?
Yep.
Okay. Can I get your name and date of birth?
Leanne Harshberger, 06/21/2002.
Perfect. And is Leanne your preferred name?
Yep.
Okay. So the physical will take about 30 minutes.
Okay.
It'll include inspection, which would be looking, percussion, which is tapping, palpation, which is feeling, and then auscultating, which is going to be listening with my stethoscope. Do you have any questions at all?
Mm-mm.
Okay, and then do you have any allergies specifically to iodine, latex, shellfish?
Mm-mm.
No? Okay. And then, would you consider yourself full code or DNR?
Full code.
Okay. So everything we do here will be kept confidential. If you have any questions at any time, please just let me know.
Okay.
So first we're going to start with a general assessment. So looking at you, you appear to have appropriate facial expressions. You appear well groomed and dressed appropriately for the weather.
Sorry.
That's okay. You appear to have good posture and are symmetric on both sides. You appear to be well nourished, and I don't note any noticeable physical deformities to you. I'm going to have you walk to the dresser and back for me. So I would note that your range of motion is good. You have stable gait. You're able to walk stable. I don't note any tremors that occur as you walk. So your behavior, you would seem to be alert and orientated. You're able to make eye contact with me when we converse, which is all expected findings. So next we're going to do a cardiac assessment. So first I'm just going to listen to your carotid artery with the bell of a stethoscope. Okay, and I'm able to hear it on both sides, and I don't hear any like rushing noises, which is expected. So next I'm just gonna palpate it. Okay, and I'm able to palpate it on both sides, and again I don't feel any rushing, which is expected. So next I'm going to have you lay down at a 30 to 45 degree angle. And then I'm just going to move your shirt down. So I am able to see your jugular venous pulsate, and I don't note any heaves. So next I'm going to feel for your apical pulse. So I'm going to go to your fifth intercostal space, mid-clavicular line. Okay, and I am able to feel it. Next, I'm just going to place my hand on your chest. And I don't, you can sit up, and I don't feel any heaves, which is also an expected finding. So next I'm just going to listen to your lungs, or your heart. Okay, so the first one, that was on the right side. That was your aortic. That was at the second rib. That is where S2 should be greater than S1, and I heard that, so that was expected. And then when you go over to the left side, that is your pulmonic. That is also where S2 is greater than S1, and I heard that, so that is expected. Then that was at the second rib. Then you go below that to the third intercostal space. That is where Erb's point is, and that is where S1 and S2 are equal to each other, and I did hear that, so that was expected. And then when you go below that to the fourth intercostal space, I heard the tricuspid valve, and that should be where S1 is greater than S2, which I heard that, so that's also expected. And then below that is the mitral, and that is also where S1 is greater than S2, and I heard that. So everything I heard was in the expected findings. Do you have any questions for me so far?
No, I do not.
Okay, so then the bell of the stethoscope is used because of low-pitched sounds. So for rate and rhythm, irregular rate and rhythm would be if the apical pulse is larger than the radial pulse, and that would be tested at the mitral location where it's in the fifth intercostal space on the left side, where S1 should be greater than S2. Okay, so the next assessment we're going to do is the thoracic and lungs. So I'm just going to have you turn around. That's good. Okay, so I'm just going to expose your back. So first,
What?
so your underwear is showing. So first I'm just going to inspect her posterior back. I would note that her skin tone is pale and even throughout. I note some macules. I note that her vertebral spinous process is straight. Her scapula is even on both sides, which is expected, and her shoulders are also flat and even throughout, which is an also expected finding. So next I'm just going to test her AP, the diameter. So I would note that it is 2 on this side, 2, 1 on the side, which is a normal and also expected finding. Next, I'm just going to palpate your back and just feel around. Let me know if there's any pain. I'm just going to move that up for you. Any pain or tenderness at any location? Okay. And I didn't feel any lumps or masses or anything, which is an expected finding. So next I'm going to do tactile fremitus. So tactile fremitus is where I place my hands like this on your back, and I'm just going to have you say 99 each time I move my hands.
99, 99, 99, 99, 99.
Okay. And each time I moved my hands, the vibrations decreased as I moved down her back, which is expected. So next I'm going to place my hands like this at the bottom of your back, and then I'm going to have you just breathe in and out. So her, my hands move bilaterally, which would indicate her breathing would be equal on both sides, and one side doesn't occur before another side. So next, I'm going to I'm going to feel for C7. So I'm going to have you tuck your neck, and I'm able to palpate it, which is a normal finding. So next, I'm going to feel by your spinous process, your paraspinous muscles. So just let me know if there's any pain or tenderness. Okay. Any pain or tenderness with any of that?
No.
Okay. So next I'm just gonna percuss. So percussion is that tapping, and I'm just gonna tap in the Z pattern.
Okay.
Okay. And so I did hear tympanic sounds, which is a normal and also unexpected finding. So next I'm just gonna listen to your lung sounds.
Okay.
So first, I'm just gonna have you breathe in and out. Okay. So, sorry. I was able to hear all vesicular sounds, which is a normal and expected finding. So next we're gonna do your anterior, the front. So I'm gonna have you turn around. So next I'm just going to inspect. I would note that your skin is even throughout. I do note some macules, which is unexpected finding. I don't note any color deformities, and I don't note that one side is bigger than the other. I'm gonna have you take a deep breath in. Okay. And I note that your coastal angle is less than 90 degrees, which is an expected finding. Next I'm gonna just feel palpate across your chest. Let me know if there's any pain. Any pain at all?
Nope.
Okay. So the next thing that I would do, I would percuss, but that would be deferred for this. So next I'm going to listen. So first I'm going to start at your trachea.
Okay.
Can you take a deep breath in? And then I'm going to go down to your side. Okay. Perfect. So the first one I did was tracheal. That should be a bronchial sound, which is what I heard. The next one is apices, which is right here. That should be a vesicular sound, which is what I heard. The next one is your midclavicular line, which is also vesicular. And then 2 down your sternal border, which would be bronchial vesicular. And in males we do 3, but since breast tissue kind of covers that up, we're gonna do 2 for female. And then I did mid-axillary, and that's also bronchial vesicular. Okay, so that finishes our thoracic and lungs. Next, we're gonna do nose, mouth, and throat. So we can cover this up. Sorry. So first, I'm gonna inspect your nose. It appears to be at the midline. I don't know any inflammation. Next, I'm gonna look. I'm gonna have you look up. So I would note that there are fine pale hairs. It's moist inside of there and light pink. So next I'm gonna palpate your frontal and maxillary. So just gonna feel. Any pain or tenderness?
Mm-mm.
Any pain or tenderness?
No.
Okay. So next I'm just going to inspect your mouth and throat. So for this I'm gonna apply hand sanitizer and some gloves. If I can get my hand. Okay. Okay, so I'm just gonna have you open your mouth for me. I would note that her buccal mucosa is moist and pink. Her teeth appear to be straight and white. Her gums, they don't appear to be inflamed or any lesions at all, which are all expected findings. So next I'm gonna just look at your sublingual area, which is under your tongue. So I'm just gonna have you put your tongue to the roof of your mouth. So I know that her sublingual area is also light pink. I do note a large vein that runs up her tongue, but that's also an expected finding. So next I'm gonna inspect your soft palate, which is at the roof of your tongue, your soft and hard palate, and then I'm gonna also look at your uvula. So I note that her soft palate is light pink. I note that there's no lesions, which is expected, and I'm gonna have you say ah, and I note that her uvula rises when she says ah, which is an expected finding. Next, I would do the gag reflex, but that will be deferred for today. So next I'm going to look at your tonsils. And I know that her tonsils should be rated 2+, which is a normal finding and an expected finding. So that would be it for the nose, mouth, and throat. Do you have any questions?
Mm-mm.
Okay, so next we're going to continue on to lymphatics. I'm just going to... I'm going to have you expose your arms for me and just hold them out. Okay, so I note that her arms are equal both sides. I do note some macules. I note that they're even in size and shape. Next I'm just going to feel for the temperature. Okay, so I am able to note that it feels the same temp on both sides. Next, I'm going to palpate bilaterally your brachial and radial pulses. So first, brachial. Okay, radial. So I am able to palpate both her brachial and her radial pulses, which is an expected finding. Next, I'm going to check your capillary refill time, so I'm just going to press down. Okay, and then her capillary refill time on both of her fingers were less than 3 seconds, which is a normal and also an expected finding. So next, we're going to move to your lower extremities. So I would note even skin tone throughout, pale. They appear to be the same size, even hair distribution throughout. And next I'm just going to feel for the temp. So as I feel bilaterally, I notice that it's even temp throughout. Next, I'm just going to push down to feel for edema, or to test for edema. So it goes back to the normal size, which would be non-pitting because it went back to normal. Okay, so next we're going to, I'm going to palpate each of your pulses. So first we're going to do femoral. That is going to be by your groin area. So I'm just going to have you lay down. I'm just going to pull your shorts up a little bit. So I am able to feel that pulse, which is expected. I would grade it 2+, which is a normal finding. Next, I'm going to do your popliteal, which is medially back behind your legs. So I'm just going to have you lay in your stomach. Okay, and I'm able to feel both of those pulses, and I would also grade them 2+. Next, I'm going to feel, palpate your anterior tibial pulse, which is back behind your ankle bone. Okay, and I would also grade those 2+. I'm going to have you turn back over. The last pulse I'm going to feel for is your dorsalis pedis pulse. So I'm just going to... Okay, so that one's a little more difficult to find, so I'm going to grade that 1+. So that will conclude the lymphatics. One thing I forgot to do on the nose, mouth, and throat, you can sit back up, was test the airflow. So I'm going to have you close one part of your nose and breathe in, and then close the other nasal and breathe in. So that would indicate you have good airflow. But that was supposed to go with the nose, mouth, and throat. So overall, that will conclude all of our assessments today. Everything we found were in the expected and normal limits. Do you have any questions for me?
No.
Okay. Everything will be kept confidential. Once I leave the room, you can change and get back into your normal clothes. And I appreciate you for coming in for your physical.
All right, thanks.